Everyone, a 7:23 on your Saturday morning, and since the fire started in Bastrop County, smoke has been blowing in across the area. You're looking live over Austin, where much of the metro could continue to see hazy conditions today, and with the smoke concerns. Here with some advice is Dr. Ryan McCorkle. He is an emergency medicine physician at St. David's Medical Center. Good morning to you.
Good morning.
I'm sure you saw some of it from wherever you were at, because we were getting emails into our newsroom from all over the area about this smoke and haze.
Absolutely. Bastrop Emergency Department especially. Seen a lot of people, especially who have chronic respiratory problems, COPD patients, asthma patients, a lot coming in when they're exposed to the smoke.
Yeah, what do you do in that scenario, in that situation with them?
We treat them like exacerbations of emphysema or asthma, usually with steroids and inhaled steroids, as well as oral, IV, and giving them breathing treatments, because those small particulate matter from the smoke really sets off asthmatics and emphysema patients.
Are a lot of them coming in from the Bastrop area specifically, or are some of them in the Central Texas area? And is it still bad for them, even if it's not as heavy as it might be in the directly affected area?
Absolutely, all over. I mean, when the wind patterns change, we see smoke even in the Austin area coming from there. We do obviously see more people that are concentrated around where the fires are, but the entire Central Texas area seeing more smoke kicked up, which is triggering our asthmatics and our emphysema patients to come on in.
If it's not as severe as maybe a trip to the doctor, is there a quick fix for people? Is there some type of over-the-counter medication that maybe they can take, or something to do to relieve the symptoms without having to take a trip to the doctor?
Most asthma and COPD patients have either their rescue inhaler or their nebulizer machine at home. They may have to use that a little more frequently after they've been exposed to smoke. Recommend trying that first, obviously, before having to come into the ER. But if that's not controlling it, you're having to use it very frequently, then it's best to come in so that we can do a longer course treatment and maybe add those steroids that aren't available over the counter.
For those of us who don't have the conditions that maybe you mentioned, just if we're fairly normal, so to speak, and we are out there, I know even our news crews covering this thing, I mean, we've been in some pretty smoky areas. Is it causing harm to our lungs to be exposed to it for, a day or two?
Short-term exposure is an irritant to the eyes, to the throat, the passages, but it passes in 24, 72 hours. That's not really a long-term concern. For people that already have those conditions, they're at the most risk. Everybody else will have some mild irritation, but usually do fine. The large particles get in those upper airways, cause the irritation. It's the small ones that get deep down into the lower respiratory tract that we're concerned about, and that's usually a more long-term exposure. But if you don't have to be there, we recommend that you not be there.
Got it. Not a good idea to maybe head out there and volunteer, so to speak, if you've got some of these allergies going on and respiratory issues. That's
correct. If you don't have to be there, less exposure would be much better for everybody.
Awesome. Well, thank you so much for your advice this morning and expertise. So we're going to have all the tips that he mentioned, anything you need to know if you've got some of these conditions on our website at kxan.com. In just a few minutes, we'll get this interview up. Thank you again.
Thank you.